Hello, and welcome to today's episode of Focus Atlanta. I am your host, Keisha Lancelin. Thanks so much for tuning in with us this Sunday afternoon. In this segment, we're going to talk a little bit about some fads and things that you've been seeing out there about weight loss. But we want you to realize that we don't want you to trade your good health for a couple of pounds. I'm here with Dr. Swathi. Thank you for making time for us. Now, you know, a lot of people see things on television, they see all these ads, and they think that they got on the bandwagon. What do you want people to know?
So I want people to know first and foremost that there are misconceptions associated with taking these GLP-1 agonist drugs. There are three. The first one is that they're a magic bullet. The second one is that they're the right fit for everyone. And the third one is that they are free of side effects, because there are actually some red flags that we need to look out for.
Okay, in terms of looking out for the red flags, are these things that we, could learn about prior to, maybe trying some of these things out? How do we find what these red flags might be?
Yeah, so these are things that, before we get on the medication that we should discuss with our healthcare provider, and to ensure that, this GLP-1 drug is the right fit. And these four red flags, the first one is, related to gastrointestinal or stomach issues. The second one is related to accelerated muscle loss. The third one is related to off-label misuse. And the fourth one is related to mental health.
Now, so often, we see these things and we think it's a quick fix, right? Can we talk a little bit about that in itself, how perhaps we should learn how lifestyle changes and bigger changes will really give us the impact that we want, as opposed to some of these quick fixes?
Absolutely. As an integrative pharmacist, that is what I'm thinking of first and foremost, is how can I personalize the therapy to help the patient achieve their treatment goals? And when it comes to weight loss, we need to think about a multifaceted approach. So first, let's think of nutrition. So how can we eat whole foods and think about, the perimeter of the grocery store, thinking about produce, protein and fiber being two of the cornerstones of nutrition. The second would be movement. So, how can we incorporate getting active, taking the dog on a walk, figuring out what exercise we like, and also incorporating some resistance training for our muscles. And then the third one, I know we lead such busy lives, especially this time of year with the holidays and work and everything, that I always like to recommend supplements. So there are 3 supplements that I recommend.
Well, you know what? When you started off with the grocery store, that in itself is huge. You know what I mean? Like you said, go around the perimeter and then you'll avoid all of the bad stuff. Like, that's the easiest thing for me to do, just personally, when I'm thinking about, especially, well, first of all, you should never go to the grocery store hungry. That's one of the biggest no-nos ever. But little tips like that, going around the perimeter as opposed to going to where some of the more unhealthy or, those type of foods are, even tips like that are super helpful.
Yes, absolutely. But I also understand around this time of year, we're going to have all these exciting events to go to with family and with friends. And so with this busy lifestyle, the supplements that I would recommend, in addition to exactly what you mentioned with nutrition and also incorporating elements of movement, are omega-3 fatty acids. Those can reduce muscle inflammation and support protein synthesis. The second one is amino acids. So you can also find this in a supplement, specifically branched chain amino acids like leucine, because those can help prevent muscle breakdown. And if, patients are taking this, the GLP-1 drug class, it is really important these 2 medications or these 2 prescriptions to take, but also to think of this other supplement called Fortitropin. You might not have heard of it because it's newer, but it's highly studied, and it's actually a natural compound derived from fertilized egg yolk. And in clinical trials, it showed that it boosted muscle protein synthesis by 18% in adults.
Oh my goodness. Now, everybody should have been writing down those supplements, because it's a huge, win for us in terms of trying to do the right thing and replacing things in our body or filling things in our body. So you can't get out of here then without giving us a website, someplace where we can kind of tap in and maybe get some of these tips.
Yes, so if you want to learn more about how to stay healthy this time of year, especially if you're taking a GLP-1 drug, please check out MYOSMD.com. There you can learn a little bit more about the study that I mentioned, but also, see some educational videos on how we can safely lose weight.
Thank you so much for making time for us here on Focus Atlanta. It was a pleasure to meet you.
Thank you so much for having me.